Kenya is now close to achieving epidemic control, having met the 95-95-95 global targets. 95% of people know their HIV status in Kenya. 102% of those diagnosed are receiving treatment, and 97% of those on treatment have achieved viral suppression. Despite a 65% reduction in AIDS-related deaths since 2013, the incidence rate remained at 0.39% per 1,000 people in 2023, with the majority of new infections occurring among those under 34 years. The HIV AIDS epidemic continues to disproportionately affect vulnerable groups, including women, girls, adolescents, and key populations, exacerbated by healthcare inequalities, stigma, and discrimination. This intersection of adversities highlight the urgency of scaling up multilateral interventions to address the compounded vulnerabilities faced by these groups. We are at a critical juncture where traditional strategies are insufficient to keep our goals of ending AIDS by 2030. While past approaches were rooted in healthcare, they often overlook broader drivers of infection, such as social and economic disparities, poverty, illiteracy, and environmental factors. Our theme calls for coordinated, inclusive, and multi-sectoral approaches to ensure universal access to prevention, treatment, and care. It also urges us to re-energize our efforts, from strengthening global partnerships and securing sustainable financing, to promoting equity and human rights, leveraging innovation, and building resilient health systems.
As we speak, AIDS claims a life every minute. By the end of this session, 90 families would have lost a loved one. We stand at a crossroads, and to retreat now would jeopardize all that we have fought for and gained. To sustain the momentum, we need to tackle the action on three fronts. First, we must tackle the fiscal crisis that is squeezing social investments. The current financial system is stacked against a sustainable AIDS response. Half of sub-Saharan countries spend 3 times more on debt servicing than on health. In fact, more went out in debt servicing than came in ODA in Africa this year. Meanwhile, for years, these nations have been strangled by interest rates 4 to 8 times higher than those of high-income countries. If we do not address the injustices of the financial system, so countries can invest in bringing an end to AIDS now, we will pay the price in many ways later. We know that the costs of tackling AIDS are less than the costs of an unending pandemic. Time isn't on our side. Real sense of urgency. Now is the moment to boost domestic financing and to renew global solidarity and commitments to meeting the financing development gap and gaveling that we gavelled in the Pact for the Future.